Now on WDBJ-7, it's gripped the nation, and it's affecting many here in our hometowns.
You put your addiction above anything else in your life.
Thousands of lives lost in Virginia.
An overdose death is a preventable one.
Tonight, messages of hope from those who have battled back.
It's okay to talk about, because if not, you're going to end up going back.
And inside the fight, as doctors across our region rush to save the youngest victims of this epidemic.
It's just heartbreaking.
Plus, for the first time, how it feels to work on the front lines.
As a community, we've got to address it.
Personal stories and expert advice for families. Tonight, timely and inspiring. A special WDBJ-7 Your Family Matters presentation. Battling Back, the Opioid Crisis.
Thank you for joining us for this special presentation. I'm Jean Jadhun. Over the next hour, you will hear from the families impacted by substance use and from the responders on the front lines. And while working in law enforcement is tough, not many things can be more difficult than having your own son arrested. WDBJ-7's Leanna Scacchetti with that story.
What time does class end?
Sheriff Kevin Hall and his son Ryan are in class today. They're here to speak to high school students about the dangers of drug addiction. But this is not just a say no to drugs presentation. It's a powerful story of what happens when you don't.
My freshman year is whenever I tried heroin for the first time.
Ryan Hall is in recovery. His was a path his father never envisioned for his successful, driven son.
Ryan seemed to have everything going for him. He was fun-loving. He was very popular, prom king, and just the all-American kid.
I was on painkillers for probably about 8 weeks.
Opioids, a powerful, addictive drug, and depression made for a combination Ryan soon couldn't control that made its way to heroin.
There was worries every time I would get a phone call at night, not just something going on here in my mind. It was going to be that I was going to be getting a phone call that, my son was dead.
It made life challenging for the head of law enforcement, especially when Ryan got in trouble with the law.
I sent 2 guys from the drug task force and asked them if they would go and find him and see if he was on heroin. If he did, and I wanted to save his life.
Ryan tells students today about his time rotating between jail and rehab, overdosing, and missing the first year of his daughter's life. But finally, a breakthrough.
What is it you feel when you walk through the doors here?
Acceptance.
Yeah.
Non-judgmental church.
Ryan is now maintaining sobriety with the help of his faith, his focus, and his father, who never gave up on him.
We've been able to spend a lot more time together. We've been able to look each other in the eye and been able to love each other again.
Now father and son are telling anyone who will listen about their story.
Think of someone like me, middle class society and stuff like that, and it's touching every walk of life.
But in every walk of life, a pathway to recovery.
Earlier this month, Ryan and his father were recognized by Governor Ralph Northam during his State of the Commonwealth address. Ryan has been touring alongside the governor to highlight opioid addiction. They've openly shared their story with people across Virginia in hopes it will reach those who need to hear it. Virginia's struggle with opioids has reached well beyond the governor and state lawmakers. In November, First Lady Melania Trump launched a new crusade against the opioid crisis, with one of our region's largest schools in the backdrop. During a panel discussion at Liberty University, the First Lady opened up about talking to her son Barron about the dangers of prescription painkillers.
The chances of you knowing someone who struggles with it are very high. I'm here to remind you that some of those decisions thought they may seem minor at the time could negatively impact you for the rest of your lives. Together with all of you, I know we can make a real difference and save lives.
My daughter Tess, my beautiful daughter Tess. What a beautiful young woman she was.
If you sit down and talk with Patricia Merriman.
One of our favorite things was to write little notes to each other like, Tessie, have a good day, I love you, love Mom, and she would do the same to me.
It won't take you long to see how much she loved her daughter Tess. Tess was smart, came from a loving family, and had a very bright future. But not even those things could keep her from the powerful grips of addiction. She, like thousands of others, was recovering from an addiction to opioids.
They are not people who are making choices out of moral failings. These are people who are struggling with a disease, and they need to be treated with love and sensitivity.
It would take Merriman several years to see the problem. Tess's substance use disorder, like so many others, started with a simple prescription.
A family physician prescribed cough syrup with codeine.
Out of that came more cough syrup, more prescriptions, and a stronger addiction, eventually leading to harder drugs.
They're not seeking the next high, they're trying not to become dope sick.
Tessa's story has become all too common across the country. It also got the attention of Beth Macy during the long, hard months she spent writing her book, Dope Sick.
Once she became addicted to these drugs that she had initially been prescribed, she was just sort of cast out.
Macy began documenting Tessa's struggles, celebrating the triumphs, but also reporting on the hard times, the times Tess relapsed, and eventually Tessa's death.
I was in my living room when I got the call, and it was Tessa's dad, and he asked me to what were her tattoos.
Tess was in a drug rehab center out in Las Vegas. She was trying to get better. She wanted to get better for her family and her son. But on a December night in 2017, she was murdered, a crime that is yet to be solved.
Now they each have their little pieces of Tess.
Out of Tragedy has now become a united mission for both Macy and Merriman. Use Tessa's story to change the culture around substance use disorders and save thousands of lives.
By all of us coming together and putting these pieces together, this is how we're going to have positive outcomes.
Through Macy's book, Dope Sick, and Merriman's personal tragedy, the pair hope to shed awareness on the lack of resources and rehab facilities, not only in the Roanoke area, but the entire country.
We're basically leaving it to volunteers to deal with the worst epidemic in the history of the nation.
Their hope is by educating people, real progress can be made, not just in memory of Tess, but for the millions struggling with an addiction right now, to save lives, to make a real difference, and to help end the opioid epidemic.
We need safe havens for these people who are trying to change their lives. We need safe places for them to go.
Josh Birch, WDBJ 7.
We now want to introduce you to a woman who struggled for years with heroin addiction. What do you expect her to look like? Where did she grow up? The answers may surprise you. Her story and how the face of addiction is now the face of hope.
I was all into sports. I played basketball and softball, so my dream was to play basketball in college.
In 2007, Kimberly Hunt had just graduated from Cave Spring High School.
Just happy that I graduated. I was happy that I was going to play basketball.
She had her whole life ahead of her, but one night was about to change everything.
And I just was around the wrong crowd. I was at a apartment complex at a party, and it was strictly like heroin. I mean, there was barely any drinking there, There was no pot. It was just strictly this drug.
Kimberly decided to try it.
At first, I didn't know how to IV use, so people are around, they did it for me. The thing about it now, it's just like, I guess everybody thought it was the cool. I don't know.
So how did it make you feel? Do you remember that first feeling?
Just not having to think about, I guess, life at that time.
What I've heard, and you can answer this from your experience, that all it takes is one time trying heroin to become hooked. Was that the case for you?
Absolutely.
Kimberly was hooked. The young woman from the suburbs was in trouble and hiding it from pretty much everyone.
We all were doing some things that you wouldn't expect us doing at that time, and it was really hush-hush.
Her focus turned from her future to figuring out how to get her next fix.
You know, I didn't feel good at all, just trying to figure out how I was going to support my habit. It was more of just trying to make sure I was well to get up in the morning and go throughout my day and put on a fake smile and face in front of everybody.
Kimberly continued using not just heroin, but methamphetamine and bath salts, and she saw the darkest side of drug use. Did you ever lose anyone you knew, friends, to an overdose?
Yes. Plenty. I can at least not name, but count like almost 10 people on my hand. 10?
Kimberly? All young people?
Yeah, people that were my age and younger. It's tough, but I pushed through it over the years, you know. It's part of the disease and the addiction, and it hurts the most just because you went to school with them.
Kimberly went for treatment several times, but kept falling back to the needle until one day in 2012.
You know, I didn't have a relationship with my family. I got really, really unhealthy, and I think over those years of in and out of treatment, jail, that I finally was just done.
And now Kimberly has turned her life around.
I'm 6 years clean.
She's a mother to daughter Michaela.
I've learned to feel better about myself. I learned to have self-esteem.
And Kimberly's passion now helping other people fight substance use disorder.
I share the same experiences that most of them have gone through.
It sounds like you're on a mission really to help.
And that it's okay to talk about it, and for them to see someone that's made it and not gone back to IV use is awesome.
Kimberly was just hired full-time as a peer recovery specialist at Carillion, where she works with other people suffering from substance use disorder. Coming up in the second half an hour on WZBJ 24, we'll find out more about the program.
Individually, everyone has been fighting this battle and doing a great job, but it's not enough.
We need to share what we're good at, and we need to share some of our most valued resources like funding and money.
There's still much more to come up in this half an hour. We go inside the NICU, where doctors are treating the tiniest victims of the opioid crisis.
Pregnant women and new moms with substance use disorder undergo treatment with not only their best interest in mind, but also their babies. This is Dr. Kimberly Simcox. She's an addiction medicine specialist in OBGYN at Carillion Clinic, and the standard of care is something called medication-assisted therapy.
We do not recommend that they go off of their medications if their bodies become dependent on it, because they can suffer from acute withdrawal, and that can be very dangerous to both the mother and to the fetus.
These women are placed on medications including buprenorphine and methadone, used to curb cravings and keep them from withdrawing.
We follow them very closely, and then we continue their care until they're at a stable point in their lives when they could potentially wean off those medications. But often, as you'll find in opioid use disorder, people are on those medications for life.
Simcox compares the disorder to a diabetic taking insulin.
And we need to normalize this and treat this as any other chronic disease in pregnancy. You know, it's just as prevalent. These women are trying to get help. They don't say, I want to take pills or I inject heroin during pregnancy. They don't say that. Nobody says that. Nobody wants that, right? We don't know what anybody else is going through.
And that's just one of the things that Dr. Jacinda Hayes has also found, but she works directly with the babies.
The moms just feel so guilty. They will start weeping while they're holding their baby.
The new transitional nursery she works in opened up about 4 months ago on the same floor of the mother-baby unit, and Hayes says that's for a very specific reason.
The mom is the #1 treatment for baby.
And they've adopted a new program developed by Yale, which incorporates more of that mom is best philosophy.
If the baby is not eating great, not able to sleep at least 1 hour, and not consolable within 10 minutes, if they get fussy, then we know, okay, well that's because of withdrawal, and they do need some medication.
They also use this space instead of the NICU setting because it's less stimulating. Dimmed lights, no beeping monitors, sound-absorbing tiles, and rocking chairs, which helps the transition.
These babies are not born addicts. They're not born with addiction. What happens is during pregnancy, while they're in mom's belly, they get exposed to medications or substances. They're born, umbilical cords cut, and they no longer have that exposure, so they go through a withdrawal process.
Hayes' goal is to prevent that withdrawal from happening at all or lessen it, and it's working. The babies being born by mothers with substance use disorder are healthier, they have higher birth weights, and are going to the NICU less.
We've had 33 babies in our transitional nursery, and we've only had to send 1 baby up to the NICU.
The kind of partnership between physicians promoting prenatal education and counseling, in addition to medication-assisted therapy, is also paying off.
In Pulaski County, the number of babies born with a drug addiction is 6 to 8 times higher than the national average. Now a groundbreaking program called Empowered Options is giving help to some of the county's most at-risk women. At the New River Valley Regional Jail, they can learn about birth control and STDs. Through the program, more than 100 women have received contraception while in jail.
So that's 100 people who, you know, going out have contraception and aren't going to get pregnant unintentionally, and thereby, if they're a substance user, aren't going to have a baby that's addicted.
I can focus on me and the things that I need to do for me and don't have to worry about something happening and me getting pregnant and then having to worry about that.
Many of the women say they're learning things they had not heard before their first pregnancy. People who are entering jail or the hospital with a substance use disorder are many times fighting other illnesses at the same time. Right now, Carilion Clinic is seeing about 180 to 200 admissions monthly. Within those numbers, they are getting about 3 new patients a week who also have hepatitis C. And HIV cases are part of a separate population that doesn't normally overlap with hepatitis C cases in Southwest Virginia. No matter what the illness might be, doctors say treating the infection is only one step in overall recovery.
If we simply treat the infection, we haven't treated the totality of the patient, because their problems actually started way back in childhood or in adolescence with a mental health disorder, then substance abuse, addiction, and now they're suffering the consequences of that.
Dr. Kirkering says there is also a need for more mental health programs to treat these patients. They describe to us what they see during emergency calls and what they'd like to see done at the state level. Don't go away.
Car, she's laying face down on the ground. But the driver, he slumps back in the seat, and the passenger is laying over on the driver. They're all, it looks like an overdose.
Calls like the one you just heard are the new normal for responders in our hometowns. People found face down, unresponsive, and many times in public places after an overdose. Sadly, those types of calls come infrequently, and when they do, first responders jump into action. I had the chance to sit down and talk with those on the front lines to see what they are finding on the streets and in the ER. We have Roanoke Police Chief Tim Jones, the Chair of Emergency Medicine at Carilion Clinic, Dr. John Burton is here with us, and Chief David Hoback with Roanoke Fire EMS. Thank you all for taking time to talk this evening. First of all, we'll start with Chief Jones. What are you seeing? What are your officers seeing out on the front lines every day when it comes to opioids?
Well, unfortunately, Jean, we're seeing folks who are afflicted by a substance abuse disorder, primarily heroin or opioids in this case. Officers are being called to the scene. We're finding folks in their vehicles, in their homes, in abandoned homes, in the homes of other people, in restrooms. Many times, if we get there before fire EMS personnel do, they actually have tourniquets still applied to their arms, syringes, in their arms or other parts of their body where they may be injecting.
We have quite a few deaths that we suspect that was the case, whether it's down in a vehicle, down in a house, and you got a 23 or 25-year-old, and we have a history with that individual that we can suspect that being the case. But until it's actually ruled through the ME's office, we can't rule on it.
Dr. Burton, you're seeing these patients when they get to the hospital. Tell us what you're seeing age-wise and what kind of condition these folks are in when they make it to the hospital.
It can be your neighbor, your family, no matter how rich or smart or any of the possibilities. So when you really get into the specifics around gender and age, we'll see the full age spectrum. Babies born to mothers who are addicted to heroin, all the way to older individuals, people in their 70s and 80s who have addiction problems with opioids. A lot of the waves and the overdose calls, particularly on the front lines too, are related to what's on the streets. And one of the things that's really driven for the last 3 years a lot of these high rates is super pure heroin on the streets, and then particularly the big actor has been when you have fentanyl on the streets. And fentanyl is a very, very strong opioid that we use in the hospital settings or for cancer patients. And when you combine that in a gram for gram dose, then it is incredibly powerful. So it's 80 times more powerful than morphine, for example. So when you put that into heroin and you mix that into heroin, it translates effectively into respiratory arrest and death very frequently. So if you have a wave where the supply has a lot of fentanyl in it, then you're going to see a lot of overdoses that weekend and that week.
The doc is correct. We can tell when we do have the pure or the fentanyl-laced heroin come through because we're having more people out that are normally used to this dose, and now that dose is taking them out, which is where we find 2 and 3 people down at a time.
This is scary stuff. What do we do about this? Chief Jones, we'll start with you. What do we do? This is a criminal offense, obviously, but even more than that.
It is. And it's a societal issue, and education is the first component. And we've been very aggressive in the Roanoke Valley, even before the state actually declared, a public health crisis, an opioid statewide issue, of getting the message out. And we've got to continue to get the message out and have people not feel like it's something that they have to cower back in the shadows and talk about amongst the family unit. I mean, there are resources available, and we want to get folks directed in the right arena so they can get the rehabilitative services that they need to get off the stuff. That's the pure bottom line of it is to get the issue addressed. It's okay to tell someone you have a substance abuse disorder, but let's get you to a component to where you can get the help that you need.
We are also going to check back in with our roundtable. That's coming up on WZBJ 24. Stay with us after this break.
Now on WZBJ 24, the opioid crisis, impacting families across our hometowns.
It's hard on kids.
But loved ones are stepping up and stepping in to take care of children separated from their parents.
I miss us being a family.
And first responders address an alarming trend among overdose victims.
You could leave, and the next 30 minutes they could die.
What happens when patients refuse treatment after being revived? Plus, how those who have gone through addiction are now helping others pick up the pieces.
This is not the end of your life.
A special presentation, Battling Back, the Opioid Crisis, continues now on WZBJ 24.
Thank you for joining us. I'm Kimberly McBroom.
And I'm Jean Jadhunt. We're here in Allegheny County. This hometown, like so many other places, has felt the impact of the opioid crisis in all walks of life, including Sheriff Kevin Hall and his son Ryan.
You've heard their story. Coming up in this half hour, we'll be meeting a few new families,
Including the story of innocent children feeling the effects of the opioid epidemic.
Yeah, that's because their own parents can't take care of them, and oftentimes grandparents step in to fill the void. The Salem grandmother you're about to meet is sharing her story in hopes of helping others. Teresa Gallagher and her husband had just become empty nesters when they found themselves jumping back into the role of parents.
So my husband and I, when we first got Kimber, we were getting ready to celebrate our 30th anniversary.
Gallagher's granddaughter Kimber was just 11 months old when they welcomed her into their home. That was 5 years ago.
She is now 6. So just started kindergarten, and I'm going back through, the school homework, reading every night and homework stuff.
Kimber hasn't asked many questions about why she's living with her grandparents, or why her stepsister was adopted, or why her 2 younger siblings are in a foster home. But sometimes she misses the faces in the photos.
She will every now and then look at her picture and say, I miss my mom or I miss my dad. But
what do you say when she says that?
I just say, yep, I said it. I know. I said, I miss us being a family.
Their family was intact until Gallagher found out her son and his fiancée were in the throes of addiction.
I think it started off just with marijuana, and that type of thing. And then it progressed rapidly after they started using heroin.
Gallagher says they would get clean, but then relapse. One of her younger grandchildren described a scary situation before Child Protective Services removed them from the home.
Sawyer, the 2.5-year-old at the time, started telling us that a mean man had come into her home and had dropped her grapes and busted her TV.
Gallagher's son and girlfriend are no longer together, and he's now living on the streets. As a mom, that has to hurt. As a grandmother, she's learned she has to protect her grandchild.
And I understand how hard it is, but you have to detach yourself, because if you don't, you get depressed. You get down, and because there's nothing you can do.
A lot of the grandparents that I talk to really struggle because they love and care for their child, but yet they're trying to take care of that grandchild, and so it's a real tension.
Megan Dalbin McNabb has done extensive research on grandparents raising grandchildren because of addiction. It's a challenge, but research shows children who can't live with their parents do better when they're placed with relatives.
Children need loving, supportive caregivers, and if a grandparent is able to do that, that can go a long way to promoting resilience of any child, no matter what their previous circumstances.
As for Kimber, she knows her parents are sick and rarely sees them. While there's no way to know for certain if her parents will overcome their addiction, options, Gallagher isn't willing to gamble with her life.
We've talked about going ahead and adopting her because we don't want we don't want the chance of either one of them getting her back.
Gallagher says she and her husband simply couldn't take in all 4 children involved here. As we mentioned, one of them has been adopted. The 2 younger ones are now living in the same foster home. But she says there are plenty of resources available for grandparents in her same situation. She credits Families Anonymous for giving her the support that she needs. Finding the right words to explain to a child why they're not with their parents is tough. Emily DiCarlo of Family Services of Roanoke Valley says there is no one-size-fits-all for every family. She stresses that the child's age should dictate what you say to them, but always be honest with them.
We want them to know that that addiction is a disease. So your mom or dad is sick and they're going maybe away to get better, or they need some help getting better, and so they're taking a break for a while.
DiCarlo says it's crucial that children know it's not their fault or the fault of their parents. Addiction is a disease. You can see why experts say addiction is a family disease. That's why educating parents along with their children is crucial in preventing it. Nancy Hands is the executive director of the Prevention Council of Roanoke County. The organization hosts community conversations about the dangers of opioid abuse. It spends a lot of time in schools speaking directly to students.
We're working very closely with Roanoke County Schools, and we're working with Health and PE, and then all of the new life counselors. We're inviting them to be part of this so that we can do this in a very collaborative way.
Among the speakers taking part in these talks are parents from our area who have lost their children to addiction and those now in recovery.
They are really the key to helping understand how did this start and how do we prevent this from ever happening again.
Hans says the Prevention Council just received part of a federal grant in July to give localities more resources in the battle against drug addiction.
Educating people about opioids is one of the biggest tools in prevention. For nearly 2 years, the Bradley Free Clinic has been using the HOPE initiative to raise awareness. The program holds monthly drop-in sessions for those seeking help, largely with the support of volunteers. Anyone who walks through the doors can get information on treatment programs, mental health services, and training on the overdose reversal drug naloxone.
540-339-9010. And again, any individual in the Roanoke Valley who has a substance use disorder and is looking for help can call that number, and we will mobilize a pair of volunteers. We do call our volunteers angels, who can meet with them, listen to their story, and find out their unique needs, and work with them to find the help that they need.
The HOPE initiative has been so impactful, it's earned recognition from Attorney General Mark Herring, who says it could be used as a model for programs statewide. The opioid crisis is being talked about everywhere, at home, at school, even at church. Recently, Williams Memorial Baptist Church invited people in to have a real conversation about opioids and their impact. They partnered with the Prevention Council of Roanoke County for that talk.
The only thing I would stress to the public is, become as well informed as you can. Learn to spot the warning signs of addiction. If you see any kinds of disruptions in normal behavior, those kinds of things, reach out to your health department, your hospitals, your local physicians. Get as well informed as you can, because once again, information is our best weapon in this.
You heard from some of the presenters earlier in this special. Tess Henry's mom, Patricia Merman, spoke, along with dope sick author Beth Macy.
All public safety agencies in Bedford County want to prevent overdoses, but they're seeing a dangerous trend. They'll save a person on the brink of dying, but when he or she is brought back, they refuse any further treatment. As Siobhan McGurl reports, the question now is what to do about it.
It's become a routine call. Paramedic Eric Fenning has seen his fair share of overdoses.
Probably one a week.
But lately, more people are turning him away after experiencing an overdose.
It makes me feel like I'm not doing my job correctly.
When EMTs respond to an opiate-related overdose, they administer this life-saving drug known as Narcan. It revives the person and can make them feel fine, but is usually a temporary fix.
Then later on, the narcotic effect comes back on and they potentially will become unconscious and suffer that respiratory arrest or that respiratory depression.
That's why it's so concerning to the department that of the 89 overdose calls this year, 16 people have refused a trip to the hospital, leaving the chief and deputy chief fearing the worst.
You could go back into cardiac arrest when we leave.
The EMTs can't force the person to go to the hospital.
Because as an individual that's conscious, alert, and oriented, even though you're doing something that's very detrimental, you to some have a right to do that.
As life-saving drugs become increasingly popular, found in homes and administered by family members, the county is asking for more education surrounding its use.
People use the Narcan, they feel they're doing the right thing, which they very much are, but it's only part of the situation.
And for the first responders, it's hard to walk away from someone they believe needs care. They're looking for answers.
It's just sad, and it's like, what else can we do?
The agencies plan to meet again next month to discuss this further, but they think to see any real changes in policies, they'll have to go through the state.
I had the chance to sit down with those on the front lines. They're the ones who see the effects up close. More now with my conversation with them.
What happens physically when someone overdoses and they're coming in? For someone who, isn't a physician,
Sure.
They stop breathing, a heart attack. What happens physically during an overdose?
The biggest issue in terms of the simplest way to think about it is that opioids are central nervous system depressants, so they reduce your level of awareness, and part of that is also your brain's ability to do things that it automatically does, like have us breathe and have our heart beat. But particularly having us breathe is something that our brain automatically does. We don't think about it, it just automatically happens. So when you have an opioid overdose, that amount of opioid overwhelms the brain's receptors with a degree of sedation and separation such that the person will stop breathing. And that's usually the most life-threatening immediate issue is they've stopped breathing.
When EMS crews arrive, they can administer Narcan and the person essentially wakes up. But overdose patients many times refuse to go to the hospital, something that's frustrating for first responders.
If that individual refuses further medical treatment, there's nothing that compels them to go to the hospital. So the EMS folks can get there and heart rate's good, respiratory issues are good, and then they can refuse to go get checked out by the doctor and his staff at a local hospital. There's nothing we can do to compel that person to go seek some sort of intervention. That's the most aggravating thing for probably the three of us sitting here, is there's no way to compel or to coerce that individual right now under Virginia law to seek additional treatment. And that's something that as a society and as a government, we've got to figure out how to do. I can compel you to go get assistance for other issues like mental health issues, but I can't if you are in some way overwhelmed by opioids or in a circumstance where you won't willingly go on your own. Dave's folks walk away, my folks walk away.
It is disheartening in many cases because a lot of times we'll come and find, 1 week the same person, the next week you got the same person, and if we're able to resuscitate them the second week, and guess what, they don't want to go to the hospital again, and the same problem continues, and it's a cycle.
The number of overdose calls can vary in the city of Roanoke from month to month. Now that Narcan is available to anyone, Chief Hoback says it's harder to track just how many overdoses there are.
We had cycles where we were running 60, 70 overdoses in 1 month and as few as 7. So it does come in cycles. But we also don't know whether our reduction of Narcan administration is also attributed to the fact that Narcan is now available in the community. So are people out there overdosing and then a layperson administering Narcan, getting them back out of their overdose status or state, and then they're okay? So those are stuff you just can't track.
These drugs are so addictive. I've heard if you have one hit of heroin, that's it. You can become addicted. The pain pills, we hear all about the pain pills. How can you speak to that? Doctor, maybe you can address that. Some people
would argue I need these pain pills because I have a chronic condition. So how do you help so people don't become addicted, but yet help people who may need pain meds?
First of all, part of the awareness there is the addiction with opioids is an incredibly strong addiction, and when we think about other addictions, tobacco, alcohol, even characterized against those or other frames of references, this is in a class all its own, opioid addiction is. We've used opioids successfully for almost 100 years now for, in this country at least, for therapy for people with acute pain. And one of the mistakes that we've made in the last 20 years is we believed that this was a good strategy for people with chronic pain. And so we've made a mistake in the last 2 decades in this country where we believed that chronic pain management would be achieved by using opioids. And what we've found after really 2 decades of doing that and practicing that in the medical world is that we haven't seen any improvements in long-term outcomes of pain and pain patients and their quality of life. At the same time, what we have seen is skyrocketing addictions to those medications. So really back to your question, there is a strategy that we have to employ that we can't completely remove opioids from the community, particularly as a therapeutic option for patients who have pain, but we've got to recharacterize the proper utilization of them from an area where we've been the last 2 decades, which has been very aggressive prescribing in chronic conditions and even in some cases acute conditions, and pull that back because of the awareness we have and the lack of outcomes as well as the addiction problems.
And we really appreciate the time they took to speak so frankly to us about what they deal with every day.
Still ahead, how the faces of opioid addiction can become the faces of hope.
We will check back in with Kimberly Hunt to see how she's paying it forward.
I feel like there's a purpose of why I had to go through what I went through in the past.
6 years in recovery, and now Kimberly Hunt is devoted to helping others do the same. Kimberly is now working full-time in a Carilion program where people who are in recovery are working to help people who hope to get there.
I just feel like it should be something to be talked about and not be ashamed about talking, like, hey, like I feel like doing this.
Kimberly Hunt is referring to the needle and the urge to go back to it.
It's still a process. I mean, I'm 6 years clean and I still think about the syringe. It's just how we think, and but that it's okay to talk about, because if not, you're gonna end up going back. I see that, and then people die.
Now Kimberly's life is devoted to helping people recover. She knows firsthand it's possible.
Just because they're going through this rough patch doesn't mean like they can't be where I'm at.
Kimberly is part of Carilion's peer recovery program. It's led by Erin Casey. Everyone here has overcome some type of disorder.
I was diagnosed in college with bipolar disorder, and I struggled with an eating disorder before college, but I was very good at pretending and managing and, hiding that. We're there to give them hope, right? We're there to be that person that shows up for them and says you're not alone.
The program began 2 years ago, and since then it's grown. All of these people are in recovery and working to help others get there too.
They are a reflection that recovery is possible because they're living proof themselves.
Erin says when a person in treatment is sent home from the hospital, they need support.
We could fix them up in every way, shape, or form, and then we're sending them back home, and it can be a really struggling environment for them, and they might relapse really quickly.
That's one key time when a peer specialist can help.
They can call them and say, I'm having this problem, what do I do? How do I troubleshoot it? A lot of times our peers will meet them in their neighborhood and go for a walk around their neighborhood with them and just kind of be like, I know it's really anxiety producing being at home, but I'm your champion, you can do this.
Kimberly says they're not there to tell people how to do it. Recovery for everyone is different.
There's no judgment. It's like we could just sit and talk, and they're calm and they feel like they can trust me.
Kimberly's life, you could say, has come full circle.
To me personally, I feel kind of like redeemed in a sense, where I have a purpose, I have respect again, and I know I've earned it. Everyone is able to recover. I always say recovery is possible.
We want everyone to know that struggling doesn't mean anything about who you are. It just is part of being a human. And we want you to be here, and we want you to know that this is not the end of your life, it's just the beginning.
The Carilion program is available to anyone, and it's free.
Carilion also has a tool that serves as a one-stop shop for treating the opioid crisis. It's called office-based treatment. It's an outpatient program with the goal of putting everything a person needs all in one building. Patients can get counseling, case management, and medication at this office along Jefferson Street.
It helps someone benefit more from counseling and therapy when their brains can be recalibrated and back to normal.
Carilion's program was one of the first in the state when it started in June of 2017. Now they're helping others in Virginia get theirs off the ground. Patients who are prescribed opioids to manage their pain often worry about the risk of addiction, and that means that doctors have had to change their approach by scaling back prescriptions and getting patients into physical therapy sooner. They also want patients to reassess their progress as they go through rehabilitation.
What's your pain level? Do you feel like you need a Tylenol? You know, assess the need. After physical therapy, absolutely. A lot of people do need some pain medication, or maybe just before it, to be successful in their rehabilitation. But as the days go by, as they pick up motion and strengthening and healing, the need for narcotics becomes less and less.
Franklin says it's important to know that there are other options, and if you're ever unsure, the best thing to do is call your doctor. When patients finish with rehabilitation, they often find themselves with leftover pain medication.
And that means the risk of opioids falling into the wrong hands. Up next, the new tool Allegheny County is using to keep that from happening. The opioid crisis has come full circle here in Allegheny County.
And while there's no perfect solution, there are steps being taken to erase the stigma.
The county recently installed this permanent medication drop box in the sheriff's office lobby. They want people to have a safe place to dispose of unused medication without fear of it falling into the wrong hands.
Sometimes people are prescribed medications after surgery and they may not use it all, especially painkillers and things like that. And so instead of them just hanging on to it and thinking, well, maybe I'll keep it around, they need to get rid of it so that other members of their family or other people in the community don't get a hold of it.
If you need a place to drop off your medication, there are other options across our hometowns. Here are a few places where you can find MedSafe kiosks. Carilion Roanoke Memorial Hospital, Carilion New River Valley Medical Center, Carilion Franklin Memorial Hospital. You can always check in with your local police department or your pharmacy for other options. And if you can't make it to a drop box, there are a few things you need to know about home disposal. If you have it available, use an activated charcoal disposal bag. If not, make sure you mix the pills with trash, such as coffee grounds or kitty litter. Place the contents in a sealed plastic bag and throw the bag away. Remember, never flush medications down the toilet.
Whether you've been directly affected by the opioid crisis or you know someone who has, we hope the stories and information we've shared with you has been helpful.
We want to thank you for joining us for this special presentation from WDBJ 7.